Good afternoon. My name is Lori Crosby, and I'm here to talk to you about how we can provide excellent emotional health care for disadvantaged populations with a chronic condition. If we go to the next slide, when we say disadvantaged populations, what we're talking about here is individuals and families who may have experienced differences in their care or challenges achieving optimal health. And these care differences and challenges may be closely linked with intergenerational, social, economic, and or environmental disadvantages. Primarily, these are based on identification of the family and or child or adolescent from a racial and ethnic minority group or by low socioeconomic status in society. And so, what we're talking about here is how to provide the best possible emotional health care for those families and youth who are at the margins of our society. If we go to the next slide, we're going to hear from Robin Kennebrew, one of our parent partners in the roadmap for emotional health. And she's going to talk to you a little bit about some of the challenges and concerns that she has experienced in receiving care for her children with a chronic health condition related to emotional health.
Just building that safe space is important. Going through talking with doctors, I always felt like I had to be strong in the first place. So to be able to let down my guard, that was something that I think was earned, and it was a process. So if they did offer resources, I would feel comfortable enough accepting the help, first of all. I was just happened to be looking online, and in the Black community, you always hear, there's a saying like "Black doesn't crack," and which basically means, we look younger than we actually are. But I like this quote, and it came from Therapy for Black Girls, and it's not that Black doesn't crack. Yeah, we do look good, but Black cracks from the inside out. So, you may not see what's going on the inside, but there's so much going on the inside. So we may look like we have it all together. We're trying to fit the part, dress the part, speak the part. But inside there's so much going on. So if you do have resources, if you do have a community, a peer group, those are all great things that would be, nice to have available.
And so Robin talks about Black doesn't crack, but it cracks on the inside. And so what is happening on the inside? If we go to the next slide, what we know is that stress and trauma from discriminatory healthcare experiences can build up. And so we know that it is stressful and it causes both a physiological and psychological response when we experience stress from direct or vicarious discriminatory encounters in the healthcare system. And sometimes these stressors can take on PTSD-like symptoms, can emerge. And so they take on PTSD-like qualities because we get exposed and re-exposed to these same stressors or these discriminatory healthcare experiences over and over. And then what happens is you start to see some responses. For example, you might see mistrust or hesitancy. You might see some defensiveness, all because the individual or the family is trying to not be re-exposed to the discriminatory healthcare experience or to protect themselves from that experience. So if we go to the next slide, what we know is that sometimes trauma, discrimination, and bias that we've encountered in the healthcare system comes out as emotional dysregulation. And so what that means is you may see a huge response to a small inquiry. And that may be because there is fear behind it, there is concern, there is protection to make sure those discriminatory experiences don't happen again. And so you might see defensive language, you might see this mistrust, this hesitancy, you might see a few other things that we'll talk about in a minute. So, one of the best resources that exist out there recently is an article that Roadmap published with their co-partners, co-parent and patient partners, called The Impact of Being Black on Living with a Chronic Condition: Inpatient Perspectives. And this article not only talks about the experiences, but it talks about some ways that teams can start to address some of these concerns. And so the article really talks about this background trauma of lived experience and how that comes into the healthcare system. It talks about other responses to that stress and trauma that individuals might experience, such as code switching and the child protective services concern, which we'll go to in a minute. But again, this resource is a great place to start. And there's also a panel discussion video that is on the website that you could also hear more about these types of perspectives. If we go to the next slide, let's dive a little bit deeper into this child protective concern. What we know is that many families fear that if they don't say they're okay, if they let someone in, that they're going to be viewed as not being able to take care of their kids and referred to child protective services. And there is data to suggest that families from disadvantaged backgrounds do get referred more often to child protective services. So when you ask someone in clinic how they're doing, they may be very hesitant for real reasons to not tell you right away how they're doing. But if you're patient, if you're persistent, you build that trusting and safe environment, then they will share with you how they are doing. Next slide. Another thing that you might see in response to stress and trauma and discrimination in the healthcare system is code switching. And code switching occurs when someone dresses, acts, talks a certain way to make sure that they are acceptable and comfortable, that others will treat them in a specific way. And so what happens is it's people don't they don't really tell you what's going on, but instead they look a certain way, act a certain way, and they know if they do that, then they will hopefully receive better care. As you can imagine, being on like that is exhausting for families. And so what we know is that we can think about these things and have these things in mind when we're asking about and addressing emotional health concerns in these populations. So if you go to the next slide, we have to remember that our job is to care for our patient, and we need to understand this stress and trauma and how it might impact what we see in that clinic room. We might have to have difficult dialogues about past discrimination, and we might need to listen and acknowledge that that has happened. But we don't have to have all the answers. We don't have to fix their experience of discrimination. We don't have to justify anyone's behavior or change the family's narrative. Instead, what we can do is build trust by listening, by normalizing, by asking, by validating their emotional health concerns. I just want to take a moment to thank you for your time today and to refer you to our Roadmap for Emotional Health Project resources.